Hi there, my name is Steve and I'm from Brilliant & Company. Today I want to talk to you about PiCO-GO and how we as a digital therapeutic for pediatric asthma patients create a healthier life. 100 years ago, a lot of people died from acute diseases such as influenza and TB. But today, a lot of death comes from chronic diseases such as heart diseases, cancer, and cerebrovascular disease. And why is that? And that's because of the problem of our old healthcare system. Here's an example. I suffered from hypertension and my doctor tells me the same thing every 3 months for 3 minutes since 2012. Don't drink, exercise more, and eat your medicine. That's it. And I know it's not effective because I am still suffering. Which is why a lot of people have died annually from chronic diseases because the old healthcare system cannot work for the chronic problems of the 21st century. It has cost healthcare and patients hundreds and billions of dollars every year. So what is DTX, digital therapeutics? It is an intervention device that uses technology and internet to provide patients with a personalized, low-cost solution to treat their diseases. A lot of companies these days are using DTX to solve the problems of chronic diseases such as diabetes, heart disease, stroke, obesity, and more. Why DTX now? Currently, digital therapeutics is growing at 20.5% every year. It is predicted to hit $7.8 billion in 2025. Investors have poured in $12.5 billion so far in investments. In terms of market size, North America is expected to dominate throughout the forecast period, followed by Europe with 21.3% annual growth rate, and then Asia because of its population. Our progress so far, we started in 2016 with Bandy, and then last year we launched PiCO, and this year we have PiCO Home in the smart home market. Next year, we plan to launch PiCO-GO, a revolutionary new device that takes in all the technologies and features from PiCO Home, plus more. PiCO-GO will track data in real time and will provide doctors an accurate and more reliable way to give diagnosis and prescriptions to their patients. For patients, they can use PiCO-GO to minimize triggers and help them manage their symptoms of asthma better and more efficiently. Most importantly, PiCO-GO will help to promote behavior and lifestyle changes through our revolutionary sleek mobile app. Very briefly, the data that we collect is PM2.5 and PM10, dangerous particulates in the air, as well as VOCs and carbon dioxides, and biometric data such as heart rate and expiratory flow rate, and interventions from professionals, discipline and motivation, support groups, and other behavioral therapies. This is the dashboard of how it would look like on the phone for patients to see, monitoring medicine management and daily log. And this is how it would look like for doctors to better understand what their patients are going through. The names will be on this side, and you can monitor all the metrics easily on one screen. So we have collaborated with many partners in Korea to make PiCO-GO a success. And this is very important because we need to have clinical trials and research and journals from these medical organizations to make PiCO-GO an evidence-based success, such as Asan Medical Center, Seoul National University, and Korea University Medical School. In terms of market, it will be $7.8 billion by 2025. The market that we focus on, North America, would be $3 billion for the pediatric asthma patients. There will be around 20.3 million people in the US with asthma, of which 6 million are children, who are our target market. And because of 6 million of them have asthma, it costs 14 million absences from school every year, which is the third ranking cause for childhood hospitalization in the US. So we predict that 25 of them will get PiCO-GO on the recommendations of their doctor. It will cost $500 or $20 on a 30-month installment. which will make this a $3 billion market. And in terms of revenue, we predict to get $750 million over 5 years, which is around 100 to 150 million per year. A benchmark in the DTX industry, an example, is Popular Health. They are doing exceedingly well to help chronic respiratory diseases patients. We aspire to be like them and to be as great and to be better. They have helped over 80,000 patients, and they were recently sold to ResMed for $225 million. So with PiCO-GO, we hope to save millions of children. Thank you for listening.